Thank you very much, Cameron. And also thank you for having us and hosting us in this ISNTD presentations. So good afternoon to all. Today, what we would like to do with this first presentation is first to present to you the type of work that we conduct at Merck together with our partners, with the intent on supporting the community to reach elimination of schistosomiasis by 2030. First, I will just give you just a very few words on who we are. So we are Merck, a worldwide company founded more than 350 years ago. And our goal and our mission, our purpose is to deliver science and technologies to significantly impact human lives. And this through actually our three major businesses, core businesses. Healthcare, it is delivering innovative treatments for patients suffering from oncological and immunological diseases. Life science, that is through its very large catalog of various products and solutions, is empowering the overall scientific community. And performance material, that is developing high technologies in a sustainable manner that is impacting our everyday lives. We are known as Merck throughout the world, but we are known in the United States and Canada as EMD Serrano, Millipore Sigma, as well as EMD Performance Material there. When it comes to the Global Health Department at Merck, our goal is to improve the health of underserved population in low-middle-income countries through combining our knowledge, our competencies with the ones of our partners, and to deliver innovative solutions. Our strategic intent and our key focus has been really to look at some specific non-communicable diseases and to prevent them and control them in low-middle-income countries. To look at also aspects of malaria from the prevention perspective in particular, and very much focusing our attention on eliminating schistosomiasis as a public health problem. Just a few words on schistosomiasis. I'm certain that among the assistants there's many experts, so bear with me on the simplicity that I'm bringing here. So schistosomiasis is one of the 20 NTDs, neglected tropical disease. This is a parasitic disease that is acute and chronic and is caused by the exposure of humans to waters containing the larval form of schistosoma. Once the infection has occurred, then there is maturation to adult worms, and then there's secretion and excretion of eggs. Eggs that then are going to be excreted either via urines and feces, maintaining the life cycle of transmission of the parasite, or the eggs are being trapped within the body of the human host. And this is leading to very severe morbidities, cancers, fibrotic tissues, anemia, cognitive dysfunctions. And what we do see is that actually schistosomiasis is endemic into 78 countries, primarily within the African continent. More than 200 million people are requiring treatment. As I was mentioning, the severe morbidities are leading to a certain degree of death, and a lot of and numerous disability burden in populations. WHO NTD roadmap, as Cameron was mentioning, the new NTD roadmap 2130 is going to be issued and launched officially in about 2 days. It's giving guidance to the community as what are the elements, what are the targets and the elements needed to reach elimination of about 20 neglected tropical diseases. When it comes to schistosomiasis, the goal is elimination as a public health issue, which has been defined as below 1% of prevalence of heavy intensity infection. Of course, there are targets for a number of countries reaching elimination by when, but ultimately by 2030, 78 out of 78 countries should be at the point of eliminating schistosomiasis as a public health issue. This comes together with a number of actions, such as, for example, strengthening the implementation of existing interventions, developing new tools, strengthening the cross-collaboration between different sectors, including WASH in particular, but also ensuring that there are the proper resources and access to the tools that are needed. So an integrated approach, in a way. An integrated approach that at Merck we have been deploying and using in our approach to fight schistosomiasis for the last few years. And this integrated approach highlighting also a certain number of strategic intent. The first strategic intent for our approach has been to support country elimination through providing existing targets, addressing key medical product needs by focusing on the development of innovative tools, fostering cross-sectoral partnership really to trigger resource and cross-disease efficiencies. We are in a field where resources are tight. We need to create and to leverage on those resources. But all this works only if the health system in which we are deploying those new tools, those medications, is resilient and strong. So we are looking also at ways to strengthen healthcare systems by, in particular, building local capacity and knowledge also. And last and not least, it's really addressing the question of fostering access to those schistosomiasis medical products. And that is going to be really the key topic of today's conversation with the various presentations we are going to be giving. Now, more concretely, how do we translate this strategic intent, this integrated approach? Well, this is translated by a series of interlinked programs going from a donation program to advocacy activities, R&D, as well as educational programs. And what I'm going to do now is to give you a few highlights on those various projects. Of course, those various projects are associated to the key pillars to reach elimination: drugs, diagnostic, WASH, health education, but also addressing our own strategic intent. The first one being reaching country elimination by providing existing treatment. Merck has been donating praziquantel, which is the treatment against schistosomiasis, since 2007 through partnerships with WHO. We are up to 200 million tablets delivered per year. And we've celebrated the 1 billion tablet provided a couple of years ago, praziquantel, since the beginning of the program. And we are very happy that we've already reached over 500 million treatment of school-aged children through 47 African countries. And the commitment continues. So this is one element. Beyond this, we want also, as I said, to address the key medical product needs for supporting this elimination agenda. And one element that comes is the need for effective interventions and new alternatives to complement praziquantel in particular. So this is the work that we conduct through our drug discovery platform, where we are looking at delivering new anti-schistosomal drug candidates to address key gaps in the target product profile that is needed to really complement praziquantel. And this has to do with resistance, but also ensuring that the new drugs are going to be targeting juvenile form of the worm. As mentioned, a pediatric formulation of praziquantel is needed. This is a need that has been highlighted for now a couple of years. And through a consortium that was launched already in 2012, this is what this product development partnership is aiming at by developing a new oral dispersible tablet of the praziquantel for children below 6 years old. And today we are in phase 3. When it comes to diagnostics, very clearly we need to have and we need to develop sensitive point-of-care diagnostics. This is the work that we are currently conducting with FIND and on the development of a rapid diagnostic test. FIND and partners, and Sarah will be presenting to you this exciting development that we're conducting together. But also highlighting some of the key elements that we are looking at more from an access perspective. We are also looking at improving what is existing. What is existing today is cattle cats. We are measuring eggs, counting eggs. And this is a work that we are currently conducting with Janssen on developing the next generation of microscopic assessment on an artificial intelligence-based approach for detecting co-infection of schistosomiasis and soil-transmitted helminths together, including a monitoring and evaluation platform. And actually, this is leading us to our other pillar, which is how to trigger and how to integrate with various sectors, and in particular to trigger resource but also cross-disease efficiencies. And here the clear example of this work with Janssen is an example of cross-donor collaboration to address not only the elimination agenda of schistosomiasis, but schistosomiasis together with soil-transmitted helminths. And Lieven will be presenting to you in a little while the elements of this work, looking at STH also, but thinking already beyond those two indications. When it comes to also cross-sectoral partnership, it's very clear that WASH plays a key role in the elimination of schistosomiasis. And here we have been developing with a number of partners also concepts and programs on development of water technologies and platforms to remove the most vulnerable populations from being exposed to those waters containing the parasite. But by doing so, what we do also is indeed looking at limiting exposure to waterborne disease in a larger setting. And when you know, and when we know that actually waterborne disease is one of the factors leading to a major cause of death in children below 5 years old. This is the type of program that we are really looking forward to see an impact on both our own disease of interest, schistosomiasis, but also looking at how this is also impacting survival of infants in some of those regions of where we are going to be deploying this program. Again, cross-disease efficiency, as I mentioned, schistosomiasis has many morbidities. One of them that is has been again somewhat neglected among this neglected disease is a genital form of schistosomiasis, and more specifically in women. And because this is very much associated now, there's increasing evidence, and this is increasingly associated with various types of cancers, but also HIV. So further understanding female genital schistosomiasis may lead also to further understanding of some aspect of HIV transmission, as well as approaching the question of cancer and assessing data and information around cancer and cervical cancer in particular within this type of populations. When now we come to the fourth pillar, as I said, to lead to elimination, it requires to have a very strong health system. And strengthening health system is part of our strategy for this particular pillar of schistosomiasis, but also for the larger sets of information and type of activities that we're conducting for malaria, for example. And here, the way we are approaching the question is by really looking at building local capacity and knowledge. Local capacity, again, strengthening health system through the WASH approach. It's not about just removing and trying to remove the exposure of people into contaminated waters, but it's also to look at where are patients going to go to get treated? And this is at the level of healthcare centers. And here we have identified very critical gap in terms of access to water and to clean water in a sustainable manner in healthcare centers. I believe with COVID, this has come back very clearly in our minds that having access to basic clean water to wash your hands, to wash your face is the first barrier against a number of infectious diseases. And in the context of schistosomiasis, this is also the case. Patients suffering schistosomiasis will go to healthcare centers. They will need to have access to a more holistic approach of not just drugs and potentially diagnostic, but also being cared for normally and within a setting of health system that is strong. So access to water in healthcare centers. Another way of building local capacity for us is to look more specifically within the programs that we have in our pipeline. And in particular, an example is the pediatric praziquantel formulation, where to ensure access, one key element that we're looking at is actually tech transfer of capacity for manufacturing in low-middle-income countries. Finally, building local capacity also from a knowledge perspective rather than an infrastructure perspective. It's really the type of activities that we conduct from a health education perspective with a number of partners, but also the tight and very strong collaboration with the Global Schisto Alliance, where there is really a lot about accelerating progress in knowledge around schistosomiasis and how to tackle the elimination pillars that are needed. And finally, this leads me to the last pillar of our strategy, which is really fostering access to schistosomiasis medical innovation. And here we will talk more about this piece in the next couple of talks, but for us really this is the key gap. We are talking about really an uncharted territory. From an advocacy and funding perspective, we are conducting a number of activities together with the Uniting Effort for Innovation, Access and Delivery platform. And here actually there's 2 examples of publications that came out last year, and I would recommend you to get to them because they are quite informative on doing the landscape analysis of the elements that are missing for access in general, and starting to think with the community about what are elements on which we can start working on. But more and beyond the advocacy element, there's really a need now to think through what are the concrete elements on which we need to work to ensure access to the pediatric formulation as well as access to the diagnostics when they're going to be available. From the pediatric praziquantel formulation perspective, you will hear, and this will be launched officially in a couple of months, we have been awarded a co-funding from EDCTP and GHIT on what we call the ADOPT program to assess those various elements and to put forward a program to really test an access strategy for this formulation. But from a diagnostic perspective, I think you will hear from Sarah and Lieven that there's also a lot of open questions, and even if we do have an ADOPT program, there's a lot of questions pending on how do we do this really concretely. I just want to finish by saying that this integrated approach with multi-type of programs going from donation, advocacy, R&D, education, fostering cross-sectoral partnership to leverage the resources and strengthening the health systems. All this work is actually an activity that where we have a grip on it, where there has been a lot of progressions in the R&D space, as well as the implementation space. But what we see is that really this access piece is the key next gap that we all have to face together. And also I want to mention that all this work cannot be done alone. And we're extremely fortunate to have many talented partners around us with whom we are working to deliver on those various programs. And those are from non-for-profit organizations, academics, profit and private companies also, but also countries. And the last but not the least, also co-founders, such as the Unfound, GHIT, and EDCT. So with this, I'd like to stop